Okay, welcome everyone. My name is Dr. Tony and I've been talking about personality disorders. And I've covered the cluster B personality disorder, and now I'm going to start on cluster C. So there are 3 cluster C personality disorders. For today, I'm going to talk about avoidant personality disorder. This one is kind of interesting, and one thing to mention is that the cluster C personality disorders are tied in with anxiety and fear. All 3 of them are. So this is avoidant. And avoidant personality, some of the symptoms are someone who is extremely shy, who is so concerned about what others think and really does not want criticism or negative feedback from others. They have a hard time socially, they feel socially inept. Many of them have low self-esteem and just have a hard time interpersonally and in relationships. They're concerned about rejection, being judged, and being criticized. As a result, they tend to avoid interpersonal interactions and relationships. Unfortunately, now with technology, a lot of people who have this personality type can go digital and not have that face-to-face and maybe feel a little bit more secure and a little bit more comfortable, which can be good in that they're reaching out and interacting with people more, but it can be bad because they're avoiding the face-to-face interactions. Now, the impact that this disorder may have on someone is it can affect them in their work functioning, because interacting with people at work may be very difficult for them. And maybe as part of their job, they don't have a choice but to interact with people face to face. It can also affect intimate relationships. Many avoidant people have a hard time maintaining intimate relationships. Again, because they have a hard time sharing, they have a hard time trusting and letting others in and being close to others for fear of rejection. So what does one do if they have some of these characteristics? How do you deal with it? Well, one way of dealing with it is through the cognitive behavioral approach that I've been talking about all along. And part of that is changing the way you think, reframing, redirecting the patterns of thought that might impact you. Again, many of these disorders occur early on in childhood, and maybe you heard a lot of negative criticism. Maybe you had a parent or a coach or teachers that really said some negative and hurtful and mean things to you, and therefore not only did it stick, but you find yourself taking over where they left off and maybe beating up on yourself in your head. So part of cognitive behavioral therapy is helping people change the tapes, the patterns of thinking that contribute to their self-talk. Something else that I find very helpful is many of these people have such anxiety that they don't want to take the initiative or reach out to others. And I find that sometimes it's helpful to actually write out a script, write out some things, and put it on index cards, things that you might want to say to someone. So if you're going to a party or you're going to some sort of event, maybe you have your script. And maybe you don't have it memorized, but maybe you have most of it in your head, so you feel a little more comfortable and a little more confident interacting with people because you know what you want to say. Certainly breathing and relaxing and meditating and spending some time, calming yourself, learning some of those skills are certainly going to be helpful with this type of disorder. And lastly, it may help in some cases to journal some of your thoughts and feelings, to get them out, or it may help to actually confront some of the stuff from the past. Maybe, relationships from the past where you've been hurt or been rejected, to try to let go. Letting go of pain from the past can really free you up, and it can really release you where you're not carrying much of that pain forward. So these are some strategies, these are some skills to learn how to deal with this personality type. If you have some of these symptoms, if you experience some of the fears and anxieties as it relates to interacting with people, you may try and incorporate some of the strategies that I've mentioned. We will press on next time and we will talk about the other two cluster C personality disorders. And I hope that from these vlogs that you're learning something and maybe actually taking it and using it to better your life. Until next time, Dr. Tony Ferretti.